Hi, this is Jim from Safety Wars. Before we start the program, I want to make sure everyone understands that we often talk about OSHA and EPA citations, along with some other regulatory actions from other agencies, legal cases, and criminal activity. Everyone is innocent until proven guilty in a court of law. Proposed fines are exactly that, and they are often litigated, reduced, or vacated. We use available public records, news accounts, and press releases. We cannot warranty or guarantee the details of any of the stories we share, since we are not directly involved with these stories, at least not most of the time. Enjoy the show.
This show is brought to you by Safety FM.
Hello there. We are back. Oh, let me move the camera over. I got a horror movie angle there. Shooting from the side. Right? It's like the old horror movies from the 1950s. How's everybody doing there? Some people pissed off over our commentary last night. Oh well. Biggest issue I see, and believe me, I have extensive experience with dealing with people with mental health issues, unfortunately. And one of the biggest issues is in the long term. Short term, you gotta defuse situations. We get it. Long term, you gotta face the mental health issues dead on. Figure out how to address them. Otherwise, you have situations like we have in Minnesota yesterday. Right? Not the only one out there. I mean, it's our mental health system here in this country is juvenile. Way it is. It's getting better. We're getting it's getting better in some ways. The main way is awareness. So for example, next month is Mental Health Month. Second week of September is Construction Mental Health Week, or is Construction Suicide Week. Because construction workers have disproportionately high levels of suicide. All this stuff goes in. So in some ways it's getting better. In some ways it's right. And some states and jurisdictions are making it easier to get people the help that they need. Not the help that they want, because oftentimes someone who has a clinical diagnosis does not realize that they need help. A lot of us have been there in the safety industry where you're just so burned out, you're just so fouled up that you don't realize how far gone you are until you take like a week off and you're like, oh man, I needed that week off. Imagine if you did not have that mechanism. A lot of times our workplaces also, they keep you in a fight or flight situation all the time, especially if you have a corporate culture where nobody wants to improve things safety-wise, where they're into that whole statistics, 0, 0, 0, 0 accidents, 0 injuries, 0 illnesses. And, they have a blame culture. Now, there was an article today shared on LinkedIn with the blame culture being to blame for more accidents. Because we're losing discipline. Yeah, there's some, you can see that. And I think the proponents of a no blame culture, I mean the leadership, they've always said, look, human resources, Jay Allen being one of them, human resources doesn't go out the door, out the window. So for example, a lot of companies have zero tolerance. Zero tolerance, not zero intelligence. Because they do have zero intelligence policies too. Zero tolerance policies. For example, the most common one I see is fall protection. Right? With that. But I've had to enforce that one myself, where we have a client has zero tolerance for falls. And okay, that's fair enough, right? You have zero tolerance for falls. The other thing is where people make obvious mistakes. They say, well, that effing procedure, I'm not going to follow it. And F that procedure. Well, guess what? That could be another thing where, okay, well, This accident happened because you did not follow the procedure and you had a hand in making the procedure, and this procedure was developed to prevent this kind of problem. So what kind of procedure are we talking about? Emergency action plans, emergency response. So, for example, there's a spill and someone decides that they're just not going to refill the spill kit, and you go there and there's no spill equipment. Or the big one is first aid kits, where someone decides, well, the first aid kit has to be replenished, has to be inspected once a week. And someone decides, well, we're not going to inspect that thing once a week. If it is such a thing, we're not going to worry about it. And then there's a problem when you go and guess what? No first aid supplies. How many times do you think that happened to me? Had a problem like that one time where the security guards were stealing all the first aid supplies. We found out because I replaced the first aid supplies with children's first aid supplies. They still met the standard and everything, but now they're working with like Fred Flintstone. So you can tell you how long ago this was. Fred Flintstone, all different types of, Little Mermaid, Band-Aids and everything. And so what happened? Well, a lot of people did not, now all of a sudden nobody was stealing them, but the people who were stealing this stuff, you see them walking around with like a, oh, where did you get that from? Oh, I had it at home. I got cut. Well, you got cut. Well, aren't you like supposed to report those things at work? Blah, blah, blah. So you get things like that. That's why you always have two first aid kits on site. Right, you have one that's accessible, and you have one with the emergency response people who are designated on site. Way we work it. That way there's always at least one full kit. But I digress. That's one way. But a lot of things go out there where, not deliberately not following procedures. Coming to work drunk is another one. One of my projects had to deal with that earlier this year, with a host employer coming onto the project drunk. So with that, that's not a no blame thing. You're breaking but the thing is, you got to put things in context and everything else. Follow the human resources laws. Do what's legal. With that, don't break the law. All right, that's the consultant's answer to everything. So here we have a situation. Right? And the headline is a little bit, I don't want to say misleading. However, it was in the New York Times today. Article by Reed Abelson and Teddy Rosenbluth. Medicare will require prior approval for certain procedures. The pilot program in 6 states will use a tactic employed by private insurers that has been heavily criticized for denying Medicare coverage. Like millions of adults, face a choice between picking health insurance paid for traditional Medicare or opt for a plan offered by a private insurer and risk drawn-out fights over coverage. Private insurers often require a cumbersome review process that frequently results in a denial or delay of essential treatments that are readily covered by traditional Medicare. This practice has a prior authorization has drawn public scrutiny, which intensified after the murder of United Healthcare executive last December. So, so they end up doing this. Now, how do they determine this? What's the plan here? Right, the federal government plans to hire private companies to use artificial intelligence to determine whether patients will be covered for some procedures, like certain spine surgeries or steroid injections. Similar algorithms used by insurers have been the subject of several high-profile lawsuits, which has asserted that the technology allowed the companies to swiftly deny large batches of claims and cut patients off from care and rehabilitation facilities. The AI companies selected to oversee the program have a strong financial incentive to deny claims. Medicare plans to pay them a share of the savings generated from the rejections. The government said the AI screening tool would focus narrowly on about a dozen procedures which it has determined to be costly and of little or no benefit to patients. Those procedures include devices for incontinence control, cervical fusion, certain steroid injections for pain management, and select nerve stimulators in the diagnosis and the treatment of impotence. Abe Sutton, the director of Center of Medical and Medicaid Innovation, said the government would not review emergency services or hospital stays. So if you have, So if you have one of those procedures, I tell you what, you're going to feel that that's necessary. All right, but now we have taken the human being out of this, putting AI into this. How much more are we going to allow as a society to do that? Last night's Star Trek episode did take this on, by the way, in an indirect way. So you check out Strange New Worlds from last night. That was, or this morning, actually, Thursday, August 28th. You check that out. Because what happened was, it was logic dictated the crewman's schedule, and it was ridiculous. Right? So you're going to get a little bit about it, right? But computers making a decision. This same thing happened here, and this is from semaphore.com. U.S. fighter pilots tried taking directions from AI for the first time. U.S. fighter pilots took directions from AI, and it wasn't successful. Plane ended up crashing. Nobody ended up dying. So what's my point? It's taken over more and more and more here. And what's going to happen in business, what's already happening. One of the friends of the program is a data engineer, and I think I mentioned this before. She pointed out to me that the companies are now going to be using this, and I've read it somewhere else also, to be going through all your work to determine whether or not your work contains racist phrases. Oh, yeah. Right? So, I don't know. It's scary times out there. You're going to let that happen? Are we going to let that? Or is this going to be really acceptable? Remember, right, how this is planned out in other countries, and they will use AI. They've been going on for a long time. This is what your value is for society and what you're going to add value to society. This is how much it's going to take to patch you up. And if one doesn't match the other, it's going to cost you more than what you're going to bring in. Guess what? You're SOL. Oh, yeah. Yeah. Look at the euthanasia movement. Right? You don't believe me. Go ahead. Look at it. We've been talking about this for 50 years. People right, but it's been euthanasia movements have been going on from time immemorial. A group of FEMA employees, and we talked about this in depth yesterday, and believe me, I'll be releasing the programs here. The document titled Katrina Declaration and Petition to Congress, right, was on there, and it goes through here. No news on this today. However, this is from EMS1.com. Impacts on training and preparedness programs. FEMA workers also voice opposition, that's in the letter, to changes affecting preparedness initiatives. Programs such as the CERT Team, Community Emergency Response Team, which I'm a member of, the National Fire Academy Youth Preparedness Council were cited as examples of resources that have been scaled back or eliminated. So let this be a preview for next month. We're going to be talking about disaster preparedness like we do every September. Let me point out, it's up to you, the listener, the viewer, however you're accessing us, to prepare yourself and your family the best you can. You prepare yourself, you prepare your family or your household, and then you can go and prepare for the community on this. The other thing is this. Look at some of the natural disasters we've had, or maybe not so natural, with the fires over there in LA, where the government deliberately did not plan things out and look the other way. I think that's what the final investigation is going to show, based on what the information we already have and everything, right? Take an interest in your community. Ask your emergency responders if they have the equipment that they need to do their job. With that, it's a very important question there. Do you have the equipment that you need to do your job? Are you prepared for disasters? Do we have, like in a lot of towns in northern New Jersey and southern New York, where I'm from, we have a lot of towns out there that have not done controlled burns, right? Where the land was converted from farmland in the 1700s, from forest, the 16, 17, early 1800s to farmland, and then back to residential areas. Some of the areas became state forests. State forests have not had any controlled burns or modern forestry practices, technologies employed there. Some of the communities in northern New Jersey, people were laughing because my mother's house, I had them cut down all the trees around it. Right? And then what happened about 6 months later, there were wildfires in the area. So guess what? We weren't really impacted on that street, but somebody called me up and said, Jimmy, I laughed at you when you had all the trees cut down around the house, but guess what? Now we don't have to worry about them catching on fire and then catching the house on fire. Right? One of our programs are, and I'm highly unlikely, but we have the procedure in place. If there's going to be a fire in the neighborhood, brush fire, all of the shrubs get taken out because now you're removing fuel from the fire. That's in our plan, our family action plan. With that, if we have a power outage, what do we do? If we get separated, what do we do? We are working on a system of communication, especially in lieu of what happened in Minneapolis yesterday, in Minnesota, in Minnesota yesterday. What is the family communication plan? If something like this happens, what do we do at school? Especially now that New York, the old plan was pick up the damn phone when you can, when it's safe, under what conditions, and let us know what's going on. Turn that speakerphone on, right, and put on there. Right, so you let responders know what's going on, and right, all this other stuff we used to do, little things. Now we have a situation where we're not allowed to have cell phones in schools during the day. And people say, well, that'll help, and this and that. There's arguments for the ban, arguments against the ban. Do you trust your local school board is prepared, or are they like Uvalde, where everyone's confused? Uvalde, Texas, with all those people killed. Now, what's going on with your town? No, thankfully, or as a consequence of 9/11, our school districts are very well prepared in our neighborhood. However, our neighborhood is not the world. There's a world outside of our neighborhood where that's not true. Here we have federal agencies. Right, I'm on a roll. We're just going to go. Federal agents. When the Drug Enforcement Administration said, this is off of Fox News, said Wednesday that 27 people were arrested in Franklin, New Hampshire in a sweeping narcotics bust that seized fentanyl, methamphetamine tied to a Mexico Sinaloa cartel, allegedly. I'm adding that in. Investigators said the supply train traced back through Lawrence, Massachusetts, a city long identified as a fentanyl hub in New England. 27 people in Franklin have just been arrested. Fentanyl and methamphetamine sourced from Lawrence, Massachusetts has been seized, and they have pictures of it. So here we have another situation. If we know that Massachusetts is a hub, this particular town, if this is true, I have no idea. This is what the DEA said. Lawrence, Massachusetts is a hub. We know it's a hub. What the hell are you doing about it? That's my question. And you can say, well, drug use, blah, 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 and we hear legalization of drugs. Okay. How many people, this is from consumershield.com, but there are multiple, pardon me, I have to rub my eye. There are multiple sources out there that cite the same information from the National Safety Council. How many people have died from fentanyl? Okay, so here we go. Starting in 1999, you have about 730 people. It's steadily gone up except for a couple of years in here, right? 2007, 2008, 2011, 2012, right? They went down slightly from the previous years. Okay. Right? Now we're up to 2023. It's 72,800. Right? According to, with this. And this article is from June 5th of this year. Who is taking this and dying? What are the demographics? All right. Here we have, of course, the computer locks up. Here we have the demographics of fentanyl fatalities reveal a stark disparity in the impact of the opioid crisis. Black Americans, in particular, hold on, this is from usafacts.org. Right, here we go. Asian deaths and drug overdose deaths with synthetic opioids involved in 100. No, what I'm going to share this. For 100,000 deaths by race. Black or African Americans, 33.7. American Indian or Alaska Native, 26.7. White, 23. Right? Per 100,000. Nationwide average, 22.7. Right? Deaths per 100,000, and Asians with the lowest going on there. So, I'll do a little bit of conspiracy theory here. All right? All right, since 2015, adults ages 24 through 45 made up more than half of all fentanyl deaths. I don't think there's a family that has not been impacted with fentanyl, including mine. Right? So this is my question here. I'll get a little conspiratorial. We have, and I quoted here from, based on the National Safety Council. I didn't get out my calculator. But since 2020, right, we've had 56,000 plus 70,000, so that's 126,000, plus 73,000 the next year, so that's 100 and 200, 126 plus 3, right? 199,000, and then we have another, right, 72. So we have 271,000, using my rough numbers, since 2000. What's that going to do to the demographics of the country? We have people in their prime using this data. We have people in their prime dying from this. These are your big earning years. 24 through 45. Those are the years you're having babies, and then you earn, once you get like 40 or more, start to earn, right, money there in big amounts. How's that going to impede our worker here? The number of workers. Question. We're not, let alone the societal effects from losing those people in that age bracket. No fathers, mothers, other family members, gone. I know of one case where a person died. They were 43 years old. Their daughter found the mother in the It was a single mom found the mother dead in the bathroom. How's that going to impact everything? This is what people are not talking about usually in with this. There are some groups. Our demographics are already shot to hell because of low birth rates. Well, how's this going to happen? Well, less production, right? And what's the solution? The Handmaid's Tale was a situation that what happens for the demographic collapse. Yes, the TV series. You have extremists that come in and you have forced births. Women are treated like that. There are communities that I know of in the Northeast that are like that, right? Also in New York and New Jersey. To get the demographics up. So here we have another thing. Black or African American, 33.7 per 100,000. Much more than the whites, right? The Indians, much more than, American Indian, Alaska Native, much more than the whites. Is this a conspiracy that we're not going to worry about helping about all these other things because there's a white supremacy going on here? Yeah, I'll call out white supremacy when I see white supremacy. And believe me, there are people out there, hey, who cares? It's that. They're not us. We're not going to worry about it. The first person to point this out to me, what I was thinking about it today, was in June of 1993, Stockton State College, now Stockton University, Professor William James. And a class I took, Black Power, he brought this up. No, that's okay. Because remember, the low birth rate movement in this country, population control, started in that goes back to the 1820s, but really in the 1920s, where we were going to get rid of, and we use as a euphemism, we're going to get rid of poor people, right? We're going to reduce therefore they're not going to be poor anymore because they're not having the children. Okay, this is what happened. This is a historical fact. Now, it's okay. It's in these other things. What about environmental justice here? So what's my point, my rant? My rant is this, folks. We got to stop it. The fentanyl. We're destroying families, destroying whole communities, destroying cultures, and that doesn't even include the financial end here. How about the first responders who have to respond to this, and the other systems, that we have set up? So these, right, that's over here. I could talk about child trafficking here too. Because that's another one here that we're just ignoring because that's not our community. That's not, right? So at a certain point, people have got to take this serious here with this. And where's all this fentanyl coming from? The feedstock for this. Yeah, it's manufactured South and Central America. Where's the feedstock? And in some cases, the real stuff coming from? It's coming from China. So when you have something about yay big, a little packet of this stuff, and if you could kill tens of thousands of people with it, I think that's something that we need to worry about. Now, I'm going to say this. What's going to stop a rogue group from going out there and spreading this stuff? What a disaster. Spreading this stuff not to drug users, but water supplies, train stations, or anywhere else. A scary thought, right? Let's remember, I should have been wearing my Skynet shirt because I became aware tomorrow. Maybe if I'm on the air tomorrow, I'll wear the Skynet shirt from the Terminator. So, it's an effed up situation we have here. We got to stop this fentanyl importation. Right? We always hear, well, you just say no. I grew up with the just say no stuff in the 1980s. We got to worry about the supply and the people. No, nobody bought this wouldn't be here. Well, guess what? Let's go from the other end of this. NPR did a story about 15 years ago, maybe 20 years ago, right? On this. You're lower income. You're a moral person. Salt of the earth kind of person. Where do you go on vacation? If you're living paycheck to paycheck and life has got you in a constant crisis mode, we all get into those modes from time to time, I'll admit. For years, I was in a crisis mode. Well, guess what? I got out of it. You're always in a crisis mode out there. It could be from, we covered Saul Alinsky's rules for radicals, right? Where you try to keep everybody off balance in a multi-vector attack on you and everything else. And you're always in a crisis mode. You're a safety professional. Every day there is a crisis, and you're not making a lot of money. You hear, well, if they're poor, that means that they are lazy. That's the other trope out. I guess it's a trope. Oh, well, now you have those people out there. They're poor. All right, they're working 60-hour weeks, 70-hour weeks. They're living paycheck to paycheck. They're working all the time. And a lot of times it's not glamorous work, which also causes people to look down on them. Now they're working all the time. They're not taking vacations. I don't take a vacation for 6 months, and I'm like, man, I need a freaking vacation. Right? Ever have that feeling? That's a normal human feeling. People are working all the time. Right? Well, the demographics we listed here, these are people who are oftentimes in the right below the poverty line. They're working all the time. Maybe they're not working, but guess what? They watch that damn smartphone and the TV. We're going to go out there. We're going to, that's our lifestyle. We got to have it. Maybe they go into a little bit of debt. Now, all of a sudden, these people are in a rut. They're not going on vacations. They're stressed out, living paycheck to paycheck. What's their only form? Maybe you're living in the middle of nowhere, because I tell you what, according to these statistics, West Virginia, right here, let me do a share screen. Look at where all the problems are. West Virginia, you have 1,084 fentanyl deaths, 67 for every 100,000. Tennessee, Kentucky, Delaware, District of Columbia, Maine, New Mexico. These are all the type of places. Have you ever gone up to Maine? Have you ever gone up to northern New Jersey, Sussex County? Is there anything for anybody to do there? What are the opportunities up in those rural areas of the country? West Virginia. Half of the people I work with on these big construction jobs, they call them the traveling road crew. They're coming from very rural areas. There's nothing to do there. So now you're dealing with a set of people who are poor. They're stressed out, right? What are they going to do as far as recreation goes? Oftentimes these are states with high illiteracy rates. Where are they? Where even if they do graduate, it's very poor quality education. What are they going to do? Drugs, alcohol, living it up. I've seen it multiple times here in my experience. And that's anecdotal. But now we're going to fault these people? That's where we are here. So this is a huge issue here with this. What are they going to do? They're going to, and a lot of these communities, high birth rate, they're going to have sex, and they're going to do drugs or alcohol or fentanyl or what have you. That's where the issue is here, guys, with all of this. It's a huge issue. So I don't have an answer other than enforce the laws as written. That's one way. But the other thing is the communities have to get up and change their culture here with this. Give something, if people are working, they're not, are gainfully employed. They're not doing a lot of this stuff. And oftentimes people who are gainfully employed do, believe me. I shared this stories already about when they came out with the drug tests in the mid-1990s. Guess, have any idea who was always the person chosen for a random drug test? I'll give you a guess. Right, yeah. Anyway, that's what I got. I've gone on for 36 minutes ranting and raving here, so I think, right? We got a lot of editing to do here. So let's go to commercial break.
Safety Wars is streaming now.
SafetyFM.com.
In the professional safety community, communication and planning are just a few keys to your program's success. The question many practitioners have is, where do I start? Dr. Jay Allen, the creator of the Safety FM platform and host of the Rated R Safety Show, has built a global foundation to help you along the way. Go to safetyfm.com and listen to some of the industry's best and most involved professionals, including Blaine Hoffman with the Safety Pro, Sam Goodman with the Hop Nerd, Sheldon Primus with the Safety Consultant, Jim Pozell with Safety Wars, Emily Elrod with Unapologetically Bold, and many others. As individuals, we can do great things, but as a team, we become amazing. Dial into safetyfm.com today and surround yourself with a powerful force of knowledge and support.
OSHA recordables, catastrophic losses, environmental disasters. You want answers? So do I. This is Jim Posel with Safety Wars.
That's my daddy!
You are listening to Safety Wars. Tomorrow's Safety Today.
I'm sorry for these rants, but like I have always said, this is talk therapy, and I'm saying a lot of what people like to hear. Now, I don't want to say like to hear, but what people are afraid to say. All these problems are bigger. They're systemic problems. Pardon me. These are systemic problems that are going to require a systemic fix. But there's a couple of ways we can do this. We can do it from top down or bottom up. If the top down, we can do it right from they work on it. We work on it from bottom up, working together. We're going to have this licked. However, it's going to take a lot of leadership out there and everything else. And I tell you, on the state level, with the legalization of all these drugs, bad move. This has been a failed experiment. I mean, I can't even walk down Clarkstown, New York, New City, down Main Street, right, without smelling marijuana all over the place, or worse. Can't do it. The safest place on Main Street is this one restaurant. It's owned by a retired DEA agent, and a retired FBI agent, and a retired CIA agent. Only place for years I would let my kids go without me, or my wife, because I knew it was safe there. But anyway, you go down there, and even at work, you see this, where you have places where they don't have a random drug testing program. It's a different corporate culture than one that does. Oh yeah. And this is one of the things with OSHA. They've basically abrogated. They said, well, no, we don't have to be careful with the random drug test, with the drug testing and accidents and everything. Guess what? If you enforce force a drug-free workplace and have policies with that, accident rates would go down. Right. So here we have, and the EPA has been really pushing this whole thing. Where let's get up the EPA website. Hold on. And again, we're going to right. We have pre-recorded stuff from the government here with these things, right? U.S. and Mexico reach agreement permanently end Tijuana River sewage crisis. Right, and they talk about this, and this was from July 24th. There we have Lee Zeldin. Right, nice photo here. Right, where they have an agreement, and we're going to clean things up. And because the issue attention cycle, we think that things are fixed. Here, so here we have. From Channel 7 San Diego, NBC, San Diego. Toxic sewer gases pollute South Bay at levels 70 times state regulations, the study finds. The research published in Science is the first major peer-reviewed study to show how airborne gases from the Tijuana River affect South Bay residents. People who live in San Diego's South Bay may be exposed to toxic sewer gas as much as 70 times higher than state air quality standards. So let's see. They have a copy of the article here, at least page 1. These heavily contaminated waters. Health concerns focus on contaminated waters. The study addresses the often ignored impact of polluted waters on air quality here. And it studies in 2024. And what are they talking about? Primarily hydrogen sulfide gas. If you're in the oil industry, like I was for many years, you know exactly what the dangers of those are. So, that's there. And here we have another one. Another article here from San Francisco Gate, which confirms the same thing. Here, Tijuana River has carried millions of gallons of untreated sewage for decades, prompting more than 1,300 days of consecutive beach closures on the Imperial coastline along the border. The toxic pollution has become so intense that the wastewater plume is visible by NASA and from satellites. Kim Prather, an atmospheric scientist at Scripps Institution of Oceanography, the Swedish professor at UC San Diego and an author of the study, said the new research also examined toxic gases coming in and out of the river. The fact there is far beyond the beach. She described that as a global issue. I tell you what, I can 100% get behind things like this. With this. So, according to an ongoing survey launched in October 2024, 98% of the people living in the Tijuana River region smelled unpleasant odors, and 99% of residents said they are concerned about the water and air pollution. Of those surveys, 71% said they experienced upper respiratory health issues with that. So, I should go and get the demographics to that area, too, because that's probably an environmental justice situation there. A legitimate environmental justice situation. Not a virtue signaling one. White House staffs top RFK Jr. deputy as acting CDC director. The White House on Thursday selected the top deputy of Health and Human Services, Secretary Robert F. Kennedy, to serve as acting head of the CDC after a clash over vaccine policy and in the departure of several agency leaders. The selection of Jim O'Neill, currently the Deputy Secretary of Health and Human Services, as interim leader of the CDC, potentially clears a path for Kennedy to continue his efforts to overhaul federal vaccine policy after the agency's previous leader balked at his requests. Right? So, basically, they're going to, with the vaccine policy on there, change things. By the way, I am getting a vaccination tomorrow. I am not anti-vaccine. by any means. And I tell you what, if you have questions on vaccinations and everything, then, on concerns, talk to your medical provider for that. So, for example, I have a policy because I had an adverse reaction to a vaccination one time where I do not get a vaccination unless it's like the next day is a day off. So that usually it's like a Thursday or Friday or even Saturday, I'll get a vaccination. I will not get one during the middle of the week. And the thing is, you have to mention, and because they put a mark on your record here if you're anti-vaccine. That goes on your medical records here. Yes, it does. Oh, no, Jim, it doesn't, blah, blah, blah. And I have a good doctor. That goes on there because if the doctor says you should get a vaccination, you don't get a vaccination, there's going to be an issue. Because why? Because of what we just talked about in the latter part of this, in the former part of this program, earlier in the program, was AI will be used to scan all this crap in there. That's because it's all done by computer now. No paper files. Everything's on the computer. Everything's researchable. So you make sure you tell your doctor, like I told mine, because I'm okay with vaccinations. I say, I'm not against vaccinations. Let me tell you that. Number one. Number two is I do not take those vaccinations unless it's a Thursday or Friday. I said that to my doctor. My doctor says, yeah, Jimmy, that's reasonable. That's because you had an adverse reaction. Okay. I said, yeah. This way, if I have an adverse reaction, I have the weekend to recover or go to the doctor, go to urgent care, something like that if it's that bad. I said, but I'm not okay, we'll put that in the file. Way it is. So that's all I got for tonight. You're going to be listening to another CDC video on hot work, the dangers of hot work. And after this, and I will see you this weekend, God willing. For Safety Wars, this is Jim Posel.